everyone. Welcome to the Smile Project podcast from the School of Dentistry, IMU. Thank you for joining us today. This section of the Smile Project is called the Dental Bites. Tune in to this section for bite-sized learning on the go. So let's begin. I'm Martha, your host for today's episode, and here we have Dr. Siddharth, who is an OMFS practicing in IMU Oral Health Clinic. In this session, we'll be discussing about the complications following the wisdom tooth removal. Dr.
Hi, Martha.
So may I know about the complications following the wisdom tooth removal?
Okay, wisdom tooth is one of the very common problem faced by the youngsters. It's one of the commonest surgeries done by an oral surgeon in a dental clinic. If you are interested in removing all the 4 wisdom teeth together, then it can be done under general anesthesia. So let's come back to the topic here. I'll be talking about complications following your wisdom tooth removal, okay? So once done, what are the things which you can expect? First and foremost is your pain and swelling, okay, which is inevitable because any trauma or any damage done to your tissues or bones, your body will react to it. So you'll be having a bit of pain and swelling after your wisdom tooth removal, which is completely normal, okay? And then your surgeon also will be prescribing you with painkillers, and at times even it's required few other add-ons like antibiotics and stuff. So the most common ones are the pain and swelling, which has to be managed, okay? And there are a lot of factors which roll out when you talk about pain and swelling, like how badly your teeth was, stuck inside the bone. We talk about positions of impacted tooth, like if it's straight or if it's angulated, or it's like completely horizontally, stuck inside the bone. So all these factors will contribute to a complications at a larger scale. So pain and swelling, if it's a very deeply impacted teeth, like stuck inside the bone, completely covered by the bone, so you need to do a lot of bone cutting to remove the tooth out completely. So that can contribute to a longer painful episodes following wisdom tooth, okay? So the surgeon will carefully plan like how it has to be done. So that's where the treatment planning comes into play. So you plan your surgery, and because we plan it in a different way, like we take x-rays, we take 3D x-rays to know the position and like how it is. And there is a nerve which is running below the wisdom tooth, which also can be affected, can be injured during your process. So if you go for an x-ray, preferably a 3-dimensional one, we call it as a cone beam computed tomography, CBCT in short, so which can actually tell you how close is your tooth to the relationship with the nerve, inferior alveolar nerve, that's what we call it as, which is one of the main nerve for the supply teeth in the lower jaw. So if you carefully plan, you can avoid that kind of a nerve injury, which is another complication following your pain and swelling. Okay, and then another one is something called as lockjaw, or you call it as trismus, okay, which is again a result of surgery, manipulating the bone, cutting the bone and tissues and all those things. So the person, after the surgery, may experience difficulty in opening and closing the mouth because of damage to the muscles there inside your mouth, so which can get affected following your surgery, okay? So that can also be overcome by taking tablets and like muscle relaxants and stuff. Or what I can advise is to go for a oral physiotherapy or just massage and open and close your mouth, like an exercise to open and close your mouth, which can relieve the trismus, post-operative trismus. And another common thing is we call it as a dry socket, okay, which is following your third molar surgery. Dry socket is very common complication from an extraction from a tooth which has been pulled out. There are a lot of factors which can contribute to a dry socket, something like age factor, or the patient is a smoker, or poor, oral hygiene status. The mouth is not being kept properly clean or something like that. So that can result in something called as a dry socket, or in medical terms we call it as alveolostitis, where there is inflammation of the bone. Because whenever there is a cut to your body, there is bleeding, and then the bleeding stops. The clotting is there. So the same thing happens to your wisdom tooth also. Once your teeth has been taken out, and then your surgeon sutures the area, and then there is blood clot. So in dry socket, what happens is the blood clot, accidentally dislodges, okay, goes away from the socket, leading to exposed bone, because underlying bone is exposed, and the oral cavity has got a lot of common cells, right? So which can take advantage of the situation, and it can cause an infection. So, which is a very painful condition where the patient can experience, like say, 2 to 3 days after the surgery. Not immediately, probably it takes about 24 to 48 hours to start for the dry socket, which is again the patient has to come back to the surgeon, and the surgeon will irrigate and clean up the area, and induce fresh bleeding, and then keep a medicament, like a medicine, inside that socket for it to heal. So that was dry socket. And then other things like infection, if you don't follow your proper instructions given by the surgeon, then you will end up having infections of the tissues around the gums, might be infected or inflamed, which can lead to abscess, pus formation. And then again, there are a lot of few small minor factors where your surgeon has to be, mindful about it, like how well the surgery has been planned and stuff. Like making a larger incision, incision means like cutting through the tissues. So making a larger incision or removing a lot of bone, will cause a lot of trauma to the tissues and the bone. And that can take a few days to heal. Comparatively, when you plan a surgery and you make incisions quite small and the bone cutting is reduced, and then you try to section the teeth, So that's the difference. When you try to remove a lot of bone, you are causing a lot of trauma. You're causing a lot of damage. Your body has to counteract the damage. So there will be, like edema formation, and then there will be swelling. So if you minimize your bone cutting and if you minimize your trauma to the tissues, the soft tissue as well as the hard tissue, the complications reduces comparatively, reduces to a much lower level. So the patient might experience pain and swelling, but then not as compared to the ones which have got a lot of exposure, a lot of bone removed. So that's where you need to do a careful planning. For doing a careful planning, you need to take a proper radiographs, and preferably for wisdom teeth, we always advise to go for cone beam CT. So where you know exactly the position of the tooth and the nerves, which is running below the tooth. And you can predict your outcome of the surgery, and you can predict the degree of nerve damage. So when I talk about nerve damage, it could be permanent or it could be temporary. So most of the cases, if at all the damage is done, it will be something like an over the sheath of the nerve which has been disturbed or something like that. So that's kind of temporary damage, which can revert in about 2 to 3 weeks. And also, a patient has got a lot of swelling that can also cause paresthesia, which we call as different sensation or reduced sensation from wherever the nerves been supplying your tissues. So usually the patient might experience numbness on the lip or inside the gums, or part of your tongue also might be affected because of the nerve. Again, the nerve to the tongue may be affected. Your clinical expertise and then your treatment planning along with radiographs and stuff can considerably reduce the complication. So to sum up, so these are the main things. You can expect pain, swelling, and sometimes difficulty in opening and closing your mouth. I mean, if you don't follow your proper instructions from your surgeon, you'll end up having something like a dry socket, what I told you before, and the nerve damage. Okay, which we always tell our patients, beforehand, so they can be mentally prepared for the worst to come. So this is, in a nutshell, I want to explain about the complications following your third molar surgery.
Thank you so much, Dr. Siddharth, for enlightening us on this episode of Complications on Wisdom Tooth Removal. That's all for today's episode, and remember to tune in for the next episode of The Dental Bite.
Thank you.